good? Everybody get the quiz done? I took the training wheels off, but I was tempted to send out another reminder. At some point, you guys are going to be able to do it on your own. So hopefully today you did it on your own. Okay? We're a few weeks into the semester, so get used to that Monday, Friday pre-post quiz. Should be good. How many would have come to office hours this morning if I wasn't doing an experiment? Okay. So maybe we can schedule something. We'll send me an email with your schedule and try to find some time this week. Okay. It's a little unusual, but I try to let you know if I'm not going to be able to make it. And then we'll make up the time some other time. Okay. So this is where we left off, but before we get started, what does a backward cow say? Very good, all right, nicely done. What do you get when you cross an elephant with a fish? Swimming trunks. Okay, last one. What do you say to Simba when he's moving slow? Mufasa. Very good. Very good. It is smoky outside, don't you think? Oh, it's horrible.
We're smoking from here.
What's that?
We're smoking from here.
Yeah, exactly. Well, I guess I'm grateful we're not underwater like other parts of the country. Right? Okay. So we're going to touch on inflammation today, or we're going to go through inflammation today, but before we get there, we need to finish up last week's lecture. And where this left off was looking at different types of changes that were taking place to the cell. So our last slide that we had was this acetaminophen poisoning slide. Okay? We're going to be looking at some of the other types of responses to injury. So we're going to be looking at things like pigmentation, which is something that we haven't covered yet. We went through this list last week. We talked about examples of, when tissue gets injured or when a cell gets injured, there's this influx of water. And a lot of times it's because the membrane gets compromised and then sodium rushes in. And you lose that sodium-potassium gradient. And water likes to follow sodium, and so water will follow sodium, and that's where you get cellular swelling. And if the cells are swelling in the tissue, then by extension the tissue is going to swell. Does that make sense? Okay, so now we kind of understand, why does the tissue swell? Well, the cells are swelling. Well, the tissue swells for other reasons too, but this is a big component of it. And the other reason that we're going to talk about in the second part of today is inflammation. So we'll talk about blood perfusion to the area, and as you bring more blood flow to that tissue, you actually bring in more fluid, right? And you have the opportunity of transudates and exudates into the tissue. But before we get there, right, we're focused on the cell last week, so we need to finish up there before we get ahead of ourselves. And the individual cells themselves go through these changes. And we're going to blow back out a little bit more macroscopically as we talk about inflammation. So we want to talk about pigments, and some of the pigments that you see inside of the cell that realizes or manifests itself in the tissue are two examples, one known as lipofuscin and the second one as hemosiderin. So hemosiderin and lipofuscin are two different types of molecules that are taken up by the cell. So let's talk about lipofuscin first. So lipofuscin is the lower right picture here. And what you're looking at is you're looking at where these arrowheads are, kind of this brown or this yellowish brown stain. And those are lipofuscin granules in cardiac muscle. And they're indicative of a wear and a tear response on the tissue. So as the tissue ages, remember ages of pathology, the tissue gets worn out. And you have some of the broke down organelles and membranes of the cells. And that collects in the cell, often close to the nucleus. And it's an indication that organelles have broken down and their remnant parts are still remaining, or that cell membranes have broken down and their remnant parts are still remaining. So in a younger patient in cardiac muscle, you wouldn't expect to see this much lipofuscin. So it's one way you can actually age a tissue, right? So you can look for the presence of lipofuscin and you can see, okay, are they a young patient or is it potentially an older patient? All right. The second example, hemosiderin. So hemosiderin is a protein that is found within the cytoplasm of liver cells, hepatocytes. And it's usually caused by an excess of iron that accumulates in that tissue. And so as iron enters that tissue bed, usually from like a ruptured vascular network, or otherwise known as bruising, you get these deposits of hemosiderin, which is a byproduct of iron metabolism.
Would that be due to the fact that for bruises, it's due to like the breakdown of small blood vessels that accumulate blood, and hemosiderin might follow with it?
Yeah, so hemosiderin follows a bruise because as the blood itself is found extravesicularly or outside of the blood vessel, that blood has iron in it, right? The iron is found within the red blood cell. The iron binds oxygen and is found within the hemoglobin molecule, if you remember back to 202. So hemosiderin is a byproduct of that iron metabolism as it breaks down. So if you ever find a bruise, right, a lot of that discoloration is because of that hemosiderin in its presence. Well, it collects in the liver normally, okay? And so you're looking at liver sample up here, or down here, and up top you're looking at another liver sample. And this is normal liver. This is not pathological liver. But these two examples, the upper right and the lower left, two different types of stains showing really the same result, and that's hemosiderin presence. Now, if the liver was diseased or if there was a blood problem, you would anticipate to see a greater extent of hemosiderin present in those hepatocytes. Okay? So you've got normal physiologic examples, and then you've got a pathophysiologic example, which is really age. This is the lipofuscin one down here. Okay, let's talk about calcium in the back.
Sorry, lipofuscin. Is there any sort of pathology where a younger patient had that recently, or is it really receiving?
Oh no, so the question is, would lipofuscin be found in a younger patient? Yeah, if there was an underlying disease, you would anticipate to see the lipofuscin in excess. But in age, even if it's a healthy geriatric patient, you would expect to see lipofuscin, like say in cardiac muscle. But in a younger patient, if there was an underlying disease, let's say there was even trauma, there was trauma to a tissue bed and you're rupturing cells, you're going to see lipofuscin. It would probably recycle over time and not be chronic. It would be broken down and recycled and reused and reabsorbed. In an older patient population, like in the heart tissue, you don't see that, it just stays. Yeah?
It's just really fast, like, which one was the healthy one and which one was the pathological one? Because I kind of said
So the bottom right,
okay.
lipofuscin, is the pathology is age.
Age.
Yeah, and then these two examples are just normal physiologic examples of hemosiderin that's found in the liver. Okay? But in a pathology state, you would expect to see more blue in this Prussian blue stain, and you would expect to see more brown in this hematoxylin stain. Okay, calcium can accumulate in the cell under pathological conditions. And there's two different types. There's dystrophic and then there's what's called metastatic. So in dystrophic examples, you find this in dead and dying tissues. You'll see this in like atherosclerosis. We'll look at this at the end of the semester. When we look at the blood vessel as it diseases over time, we'll see calcium deposits within the vessel. In fact, it's so aggressive. Calcium is actually pretty hard. It's a very solid structure. And so these blood vessels that are usually compliant, when they calcify, they become hard. They harden. They literally, that's what sclerosis means, is hardening of the artery, atherosclerosis. And they actually, we've measured this in the laboratory, like if you try to cut through the blood vessel, if you have a tube and you cut through the blood vessel and you fillet it open. And I have a picture of this on BB Learn from a previous semester, so if you look through the announcements on BB Learn, you'll see this. It's a blood vessel that's pinned open, and it has some luminal junk that looks like this, and that has the same hardness as a pumice stone. We've actually measured it. Okay, this is a project where we're actually trying to find an artificial replacement so we can test it in the laboratory of these cardiovascular devices. And so we got all these cadaveric vessels, we measured the hardness of the vessel, and then we found natural occurring substances that we can manipulate to actually make an artificial lesion. And pumice stone, you know the stuff that you rub on the bottom of your foot? That's the hardness of these atherosclerotic lesions, okay? So you're seeing right here, you're looking down, kind of down the barrel of the aortic valve, and all of this collection of tissue is all calcium deposition from a dystrophic pathology. Not supposed to be there. So the leaflets of that aortic valve are not going to approximate the way they used to. They're not going to close. And so you're going to have aortic valve regurgitation. Is there a question or comment?
Yeah, I was just going to say we were doing someone's heart, like an autopsy, and we were cutting like the coronary arteries, and there was like light sticks of calcium like in them, and it like crunch.
Yeah, so like when we get these vessels and we pull them out of these cadavers, and you take a straight razor blade to longitudinally fillet it open and then open it up like this. By the time you got done, halfway through, the blade was dull. Like if you looked at the edge, it was already jagged. That's how hard these vessels are. I mean, you literally hear them crunch when you push down with the razor blade. They literally crunch. Okay, the second type is called metastatic. And metastatic is just referring to a lot of causes of hypercalcemia. So you would have hyperthyroidism, or calcium levels would be imbalanced in the blood, and then you would see calcium accumulations systemically throughout the body, maybe not just in the area of the vascular supply. You would see it in other places too. Like you might get kidney stones, for example. Okay, so here's a review question as we wrap up last week. Okay, there wasn't a lot of content, but what I didn't want to do is rush through it and lose you in the last couple of minutes. Okay? It's not worth it. So, gross appearance of the myocardium, shown from a 58-year-old man who was admitted with chest pain, is most consistent with which of the following microscopic changes? So first off, you have to decide, do I think it's apoptosis or do I think it's necrosis, right? Because you have four answers for necrosis and one answer that's apoptosis. Okay, so how many of you think this is an apoptotic mechanism? Okay, good. No one's raising their hand. Okay. Now you have four choices. Which kind of necrosis is it? Okay, is it liquefaction, caseous, fat, or coagulative? Okay. How many of you say liquefaction? A. How many of you say caseous? Okay, a couple. How many say fat? A couple. How many say coagulative? Okay, those of you that raised your hand with coagulative, someone give me an explanation as to why it's coagulative necrosis.
There's different colored wet lesions on the organ.
Okay, so there's different colorations of the lesions. Okay, you might see that though with liquefaction too. I agree that's true, but that doesn't necessarily mean that it has to be coagulative.
There's more of like a branching effect with a lot of the necrotic scars on it.
A branching effect with the necrotic scar, like in here.
Yes.
Okay. Okay, closer. How about back there?
Seems like it's caused by ischemia. Could be. Looks like there's a lack of blood flow.
A lack of blood flow. Okay, and how do you know that from this picture?
Because of what he said, from the, there seems like a branching effect.
Because of what he said? Yeah. Okay, so a branching effect from ischemia? Okay, I agree. There's some more information that would help definitively, yes, right here?
It's because he had a heart attack, right? So the coronary vessels weren't giving the heart enough blood.
Okay.
Which is
Okay, so it's a heart attack. The coronary vessels have a branching pattern that leads to more of this branching like scar. I would agree. Okay, all of that is collectively true. In the back?
There's a powder as well as a well-defined line to,
Okay, so it's discolored and there's well-defined lines, and I'm looking for two specific dead giveaways. You're all correct.
Coagulative necrosis often occurs in the heart. And
Can you say that a little louder, because that was perfect.
coagulative necrosis often occurs in the heart.
Coagulative necrosis often occurs in the heart. It is branching, it is due to ischemia, it is shaped very nicely. We didn't say a wedge format, but that's usually what it is, from a branching. But what are some other organs that are dead giveaways that they're coagulated? Spleen was the picture in lecture, right? Spleen, kidney, heart, okay? Liver, yep. A lot of these tissues that are going to have like a branch-like network, like what was being described here. So you were all correct. I just wanted to make sure that you understood. It's a really easy question if you just know that certain organs lend themselves to a coagulative style of necrosis. You with me? All right, cool. Any other questions? Okay. So, I hope you don't need a break. You guys need a break already? Are you good? Okay. We're gonna pause and restart, and then we're gonna get into today's